Home Health Aide Practice Exam. Number 1. As a home health aide, you, A. Work alone. B. Work as part of the healthcare team. C. May become the leader of the healthcare team. D. Will never get any further training after orientation. The correct answer is B. Work as part of the healthcare team. Number 2. When you work in the home, you will be A. Responsible for making decisions without any help. B. Working under the supervision of a professional supervisor. C. Away from your office and have no way to contact your employer. D. Responsible for calling the physician with information. The correct answer is B. Working under the supervision of a professional supervisor. Number 3. As a home health aide, it is your responsibility to A. Plan the client's care. B. Do only the tasks that the registered nurse or therapist assigns to you. C. Try to do your best, but not ask for any help. D. Compare assignments with your coworkers. The correct answer is B. Do only the tasks that the registered nurse or therapist assigns to you. Number 4. Which of the following is important in communicating with people? A. Courtesy. B. Tact. C. Listening. D. All of the above. The correct answer is D. All of the above. Number 5. Body language is A. A way of communicating feelings by using the body, facial expressions and the eyes. B. Only used by clients to tell their doctors what is causing them problems. C. Only used by persons who are deaf and mute. D. The newest dance craze. The correct answer is A. A way of communicating feelings by using the body, facial expressions and the eyes. Number 6. Aid care for a conscious patient should be preceded by A. Asking the patient for his permission to go ahead with the procedure. B. Telling the patient that you would like to have his cooperation. C. Giving an explanation of what is going to be done. D. Explanation to the patient that the doctor ordered this done. The correct answer is C. Giving an explanation of what is going to be done. Number 7. Miss Ferris, a home health aide, is assigned to care for Mr. Conway. Miss Ferris notices that she feels very angry when she is with Mr. Conway. What should Miss Ferris do because she feels this way? A. Tell Mr. Conway how she is feeling. B. Find out if other aides have felt this way. C. Try to pretend that Mr. Conway is someone she likes. D. Talk with the agency supervisor about the situation. The correct answer is D. Talk with the agency supervisor about the situation. Number 8. A patient accuses a home health aide of stealing $5. The aide has not taken the patient's money, but the patient does not believe this. What should the aide do? A. Ask the other aides who care for the patient if they took the $5. B. Ask the patient why the aide is being accused. C. Offer to give the patient $5. D. Notify the agency supervisor. The correct answer is D. Notify the agency supervisor. Number 9. The patient tells you he has not moved his bowels in 3 days. What should you do? A. Tell him not to worry about it. B. Tell him to take a laxative. C. Report it to the nursing supervisor. D. Pretend you didn't hear him. The correct answer is C. Report it to the nursing supervisor. Number 10. Which of these actions is the home health aide permitted to take in relation to drug administration? A. Recording and reporting the patient's reaction to the medication. B. Handing out non-prescription medications to the patient who asks for them. C. Adjusting the dosage of medications given to the patient. D. Adjusting the times medications are given to fit into the patient's activity schedule. The correct answer is A. Recording and reporting the patient's reaction to the medication. Number 11. When a patient complains of pain, what should the home health aide do first? A. Ask the patient to describe the pain. B. Call the patient's doctor. C. Offer the patient some warm tea. D. Change the patient's position. The correct answer is A. Ask the patient to describe the pain. Number 12. A patient's prescription for heart pills has recently been changed. The home health aide should notify the agency supervisor immediately if the patient makes which of these comments? A. The pills are very expensive. B. These pills are different shape from the pills I used to take last year. C. I have a rash on my stomach since I've been taking these pills. D. I can't take these pills unless I have really cold water to drink. The correct answer is C. I have a rash on my stomach since I've been taking these pills. Number 13. Mrs. Rand, who has diabetes and takes insulin regularly, tells the home health aide that she feels very nervous and jittery. What should the aide do immediately? A. Take her temperature. B. Find out when she has her next doctor's appointment. C. Have her lie down in bed. D. Give her a glass of orange juice. The correct answer is D. Give her a glass of orange juice. Number 14. For which, if any, of these body areas is 99.6 degrees Fahrenheit, a normal temperature? A. Axilla. B. Mouth. C. Rectum. D. None of the above. The correct answer is C. Rectum. Number 15. When taking a patient's pulse, you should take it for A. 15 seconds. B. 1 full minute. C. 5 seconds. D. 2 minutes. The correct answer is B. 1 full minute. Number 16. When a patient's respirations are being counted, it is best that the patient A. tries to breathe evenly. B. Tries to breathe as deeply as he can. C. Sits up straight. D. Not be aware that the respirations are being counted. The correct answer is D. Not be aware that the respirations are being counted. Number 17. During a visit, you need to wash your hands after removing gloves. A. Before you give physical care to the patient. B. After you pet the dog. C. Before you leave the patient's home. D. All of the above. The correct answer is D. All of the above. Number 18. In what situation should gloves be used? A. The patient is vomiting. B. The patient has been incontinent of stool. C. The patient has a drainage wound. D. All of the above. The correct answer is D. All of the above. Number 19. If you notice the patient's catheter is not draining, the first thing you should do is A. Call your supervisor. B. Empty the drainage bag. C. Check the tubing to see if it is kinked. D. Do nothing. This is the nurse's problem. The correct answer is C. Check the tubing to see if it is kinked. Number 20. Which of the following is not recommended for promoting good daily bowel habits? A. Drinking plenty of water. B. Taking laxatives daily. C. Exercising regularly. D. Eating well-balanced meals. The correct answer is B. Laxatives. Number 21. The patient's pulse has been between 90 and 110 beats per minute since his first aid visit. Now you find it to be 58 beats per minute. What should you do next? A. Tell the patient he must be getting better. B. Wait 15 minutes and take the pulse again. C. Inform the supervisor right away. D. Just record the pulse in the normal way. The correct answer is C. Inform the supervisor right away. Number 22. Mrs. Amos has not had a bowel movement for 3 days. She has always given herself an enema if she does not have a bowel movement for that long a time. Mrs. Amos asks the home health aide to give her an enema. What should the aide do? A. Give Mrs. Amos an enema. B. Tell Mrs. Amos to wait another day. C. Suggest that Mrs. Amos take a laxative first. D. Contact the agency supervisor to discuss the situation. The correct answer is D. Contact the agency supervisor to discuss the situation. Number 23. Part of your duties as a home health aide are to assure a safe home environment. This includes a proper infection control with good hand washing. B. Electrical and fire safety. C. Moving things which may cause the patient to fall. D. All of the above. The correct answer is D. All of the above. Number 24. A patient is receiving oxygen through a nasal device. What safety precautions should the home health aide take? A. Keep the television set at least 5 feet from the oxygen tank. B. Do not permit the patient to drink soda. C. Allow no smoking in the patient's room. D. Do not use any lotions that contain oil in the patient's room. The correct answer is C. Allow no smoking in the patient's room. Number 25. A patient is choking on some object that is caught in his airway. Before first aid measures are applied, find out A. If the patient's pulse rate is over 80. B. If the patient can swallow clear fluids. C. If the patient can speak or cough. D. What medications the patient has taken in the past 24 hours. The correct answer is C. Ask if the patient can speak or cough. If the patient cannot speak or cough, perform abdominal thrusts, also referred to as the Heimlich maneuver. Number 26. While giving a bath on a shower chair, the patient suddenly gasps and becomes unresponsive. The home health aide should A. Call for family assistance and continue with the bath. B. Leave the patient and call 911. C. Lower the patient to the floor, call for the family to call 911, determine if CPR is needed and initiate it if indicated. D. Tell the family to stay with the patient while you call 911 and the supervisor. The correct answer is C. Lower the patient to the floor, call for the family to call 911, determine if CPR is needed and initiate it if indicated. Number 27. For which of these emergencies is a knowledge of pressure points essential? A. Heat stroke. B. Burns. C. Food poisoning. D. Bleeding. The correct answer is D. Bleeding. Number 28. The telephone numbers of all of the following are important to a patient. Which number must the home health aide have next to the telephone? A. The patient's clergyman. B. The drugstore. C. The emergency medical services. D. The next door neighbor. The correct answer is C. The emergency medical services. Number 29. A neighbor has asked you some questions about the patient you are presently taking care of. Mrs. Collier is dying, isn't she? How will you answer her? A. Mrs. Collier is doing as well as can be expected. B. I am sorry, but I cannot discuss Mrs. Collier. C. Yes, it's too bad, but she's very ill. D. How did you know about Mrs. Collier and her illness? The correct answer is B. I am sorry, but I cannot discuss Mrs. Collier. Number 30. Which of these statements about the elderly is true? A. They cannot change. B. They can learn new things. C. They want to become dependent on others. D. They do not enjoy meeting new people. The correct answer is B. They can learn new things. Number 31. When working with person who are disabled, the general goal of care is to A. Provide constant supervision. B. Provide total care. C. Promote maximum self-care and independence within the limits of the person's ability. D. Promote the complete return of the person's abilities. The correct answer is C. Promote maximum self-care and independence within the limits of the person's ability. Number 32. It is Mrs. Amos's usual time for lunch, but she says she is not hungry yet. This is the first time that Mrs. Amos has made this type of statement. What should the home health aide do? A. Insist that Mrs. Amos eat at this time. B. Tell Mrs. Amos to let the aide know when she wants to eat, and remind her that it is important that she have lunch. C. Tell Mrs. Amos that if she does not eat by herself, she will have to be fed. D. Tell Mrs. Amos that it took a lot of time to prepare the food and that she should eat it while it is fresh. The correct answer is B. Tell Mrs. Amos to let the aide know when she wants to eat, and remind her that it is important that she have lunch. Number 33. The ability to make observations is even more important when working with infants and young children than it is when working with adults. The chief reason for this is that infants and young children, A. do not like to be told what to do. B. Are usually sicker than adults. C. Enjoy human contact more than adults. D. Cannot explain how they feel. The correct answer is D. Infants and young children cannot explain how they feel. Number 34. Which of the following is most appropriate practice to promote good skin care in the elderly? A. Keep the skin clean and well moisturized. B. Apply alcohol to bare areas of the skin. C. Wash daily with scented soaps. D. All of the above. The correct answer is A. Keep the skin clean and well moisturized. Number 35. If dentures are not worn when sleeping, where should you store them? A. Wrap in a washcloth. B. Put in a sterile container. C. Wrap in a gauze pad. D. Place in a clean container in clean water. The correct answer is D. Place the dentures in a clean container in clean water. Number 36. Why is it important that a patient have good mouth care? A. Bacteria in the mouth can cause tooth decay and gum infections. B. The saliva in the mouth is the source of stomach juices. C. Poor oral hygiene causes more saliva to be made. D. Poor oral hygiene interferes with the sense of smell. The correct answer is A. Bacteria in the mouth can cause tooth decay and gum infections. Number 37. An elderly male patient occasionally wets his trousers. What should the home health aide do? A. Give him fluids with his meals only. B. Avoid giving his coffee and tea. C. Tell him if he urinates on himself he will have to be put in diapers. D. Encourage him to go to the bathroom at least every 2 hours. The correct answer is D. Encourage him to go to the bathroom at least every 2 hours. Number 38. In giving foot care to a patient who has diabetes, the home health aide may take which of these actions? A. Clean under the toenails. B. Cut the toenails. C. Soak the patient's feet for 15 minutes in a basin of warm water. D. Put lotion on the patient's feet after drying them. The correct answer is D. The home health aide can put lotion on the patient's feet after drying them. However, lotion should not be placed between the patient's toes. Number 39. A patient lying on his back has slid down in bed and needs help in moving up again. To start this, the patient should, if possible, A. Raise himself on his elbows. B. Separate his legs widely. C. Arch his back. D. Flex his knees and push with his feet. The correct answer is D. Flex his knees and push with his feet. Number 40. Before helping a patient into or out of a wheelchair, which of these actions are necessary? A. Have the brakes unlocked and leave the footrest down. B. Lock the brakes and fold the footrest up. C. Have the brake unlocked and the footrest up. D. Lock the brakes and leave the footrest down. The correct answer is B. Lock the brakes and fold the footrest up. Number 41. When assisting a patient to walk with his walker, you should A. Clear a pathway and remove all safety hazards. B. Stay close to the patient's side. C. Stand on the other side of the room. D. A and B. The correct answer is D. A and B. Number 42. A patient who has been on bed rest is to get up in a chair. The home health aide helps the patient to sit on the edge of the bed. The patient says, "I am dizzy." What should the aide do? A. Rub the patient's feet. B. Help the patient to a standing position and see if the dizziness goes away. C. Support the patient in a sitting position and wait a minute or so to see if the dizziness goes away. D. Lay the patient back down in the bed and, after ensuring that she is safe, notify your nursing supervisor. The correct answer is D. Lay the patient back down in the bed and, after ensuring that she is safe, notify your nursing supervisor. Number 43. Patient has had a stroke and has a right-sided weakness. The patient can walk with a little assistance. It is best for the home health aide to assist the patient by walking in which of these positions? A. Directly in front of the patient. B. Directly in back of the patient. C. On the patient's left side. D. On the patient's right side. The correct answer is D. On the patient's right side. Number 44. Mr. Stone is 76 years old, needs help with bathing, and has a Foley catheter in place. He has great difficulty walking and uses a wheelchair. When helping Mr. Stone from the bed to the wheelchair, which of these actions is essential? A. Place the foot supports of the wheelchair so that he can step up on them. B. Have a blanket draped in the wheelchair. C. Have the brakes on the wheelchair in a locked position. D. Place a pillow on the seat of the wheelchair. The correct answer is C. Have the brakes on the wheelchair in a locked position. Number 45. To prevent bedsores in the elderly, you should A. Change the patient's position every 2 hours if they are unable to do so themselves. B. Get the patient out of bed if they are allowed to do so. C. Ensure adequate nutrition with special emphasis on protein intake. D. All of the above. The correct answer is D. All of the above. Number 46. The home health aide should be sure to take which of these actions when caring for a newborn baby? A. Support the baby's head and neck when picking the baby up. B. Clean the inside of the baby's ears with cotton swabs. C. Use petroleum jelly to keep the area around the baby's navel moist. D. Hold the baby only at feeding and bathing times. The correct answer is A. Support the baby's head and neck when picking the baby up. Number 47. Which of these statements describes good body mechanics? A. Carry heavy objects as far away from the body as possible. B. Bend the knees when lifting an object off the floor. C. Bend over at the waist when lifting an object from the floor. D. Lift rather than push a heavy object. The correct answer is B. Bend the knees when lifting an object off the floor. Number 48. When caring for a patient who is on bed rest, what should the aide do to prevent bedsores? A. Keep the top sheets well tucked in. B. Keep the bottom sheet free of wrinkles. C. Use only sheets that are 100% cotton on the patient's bed. D. Use only woolen blankets to cover the patient. The correct answer is B. Keep the bottom sheet free of wrinkles. Number 49. Physical therapy has started range of motion exercise. Which of these statements about exercise is true? A. If a patient cannot talk, do not explain the exercises to the patient. B. During exercise, all joints should be moved in all directions. C. When the patient does not assist when the joint is moved through its range of motion, the exercise is called active range of motion. D. It is important to support the body parts above and below the joints when they are moved during exercises. The correct answer is D. It is important to support the body parts above and below the joints when they are moved during exercises. Number 50. Foods on a liquid diet would include A. Chicken, eggs and toast. B. Chopped and strained foods. C. Broth, tea and jello. D. Lightly seasoned foods. The correct answer is C. Broth, tea and jello. Florida Training Academy is owned and operated by a registered nurse. Thank you for